Good afternoon, ladies and gentlemen. Welcome to our new segment of Medcast, where we bring you the latest medical expertise. Today, we are joined by Dr. Yousef AlThafiri, a skilled ophthalmologist specializing in the diagnosis and treatment of eye conditions. From common issues like vision correction to advanced surgeries that restore sight, Dr. Yousef AlThafiri will shed light on how modern ophthalmology is making a difference in patients' lives. Welcome, Dr. Yousef.
Welcome. Thank you. Thank you very much for
We are
having
so
me.
honored to have you actually today.
Me too. Me
Doctor-
too.
Doctor-
Actually, this is my first time, at such podcast.
As a
I've never
podcast,
been. Yeah, I always do
La-
like TV interviews, but this is my first experience.
even in English?
Even in English or Arabic.
Oh,
Both,
that's a
both,
very good
both.
opportunity
So
for
it's
us.
going to be
Okay, that's very great. Dr. Yousef, let's start talking about the eye and the anatomy of the eye. Could you please address the most important parts of the eye in general?
Let's say, Ali, if you want to look into a house and the door is closed, what do you do?
If it's closed, then you can't see
Then you
anything.
peek through the window.
Yeah.
That's why the eye is called the window to your soul. Because through the eye, we can see everything that's happening in the body. Because the eye reflects how healthy you are, how sick you are. Okay? So it's really important for an ophthalmologist to know what the patient have. Or sometimes we actually diagnose what the patient have before even he knows about it through just eye exam, simple eye exam. So it's really important to know that, the eye, as you mentioned, anatomically, is consisted of like 4 parts. The first part is the cornea, as you can see. It's the clear part in front of the eye. Then the white part is called the sclera. The sclera is a protective shell. And then behind the cornea, you have the iris, which gives the color of the eye. And the iris also controls the pupil size of the eye. Then you go to the lens, which can control the reflection of light into the 4th part, which is the retina, which is like the film in the camera, that you can see clearly the picture through this. So simply, this is the anatomy of the eye.
Okay, that's very clear and great. But now, because the eye is somehow located in the body, many people think it is not related to the other parts of the body. Could we say that chronic diseases could affect the eye and the eye, let's say, overall health?
Yeah, it does actually. And I can tell you an example. One patient came to us looking for refractive surgery. And then, we take history, medical history. Do you have anything? She never mentioned anything. She said, no, I don't have any problem.
Yes.
But, as a doctor, we have to do full exam. During her full exam, I noticed that there's something in the retina. There is some vasculitis. There is some blood in the retina. So I asked her, listen, you have something. I mean, you said you have nothing, but
Probably
you have something.
she didn't know it before.
Yeah, she had lupus. And she said, and she know that she had lupus. But she didn't mention it because she think it's not related
To the
eye.
Yeah.
That anything she have, it's not related to the eye, which is wrong. Because, some diseases, it's contraindicated to do any refractive surgery. So, yeah, I mean, eye is part of your body. It's affected by all diseases that
Even
you can
like-
think of.
Even if we say like diabetes and hypertension.
Of course, diabetes is
everything.
number one. Diabetes is number one. Rheumatoid arthritis, sickle cell disease, Behçet disease, chronic bowel syndromes, name it. The eyes have to be part of it.
Okay, that's very great. Again, before getting into much details about the effect of the chronic diseases into the eyes, is there like any recommendations you would give to the our dear audience in order to keep the eye as much as healthy as we can?
Yeah, first of all, diet.
Diet.
Yes, you have to really eat healthy. And, this time, no one is eating healthy.
Yes.
All fast food, junk food. But, diet have to include vegetable, have to include fruits, have to include fish, have to include protein, everything combined, So first of all, diet, and then avoid smoking, exercise, examine your eye annually, especially if you have family history, or if you have diseases like, hypertension, you are diabetic, you have rheumatoid arthritis, you have to follow up, with ophthalmologist.
With the doctor, yeah.
Yes.
And especially stick with the taking the medications as well, because some people might ignore the medications prescribed by the doctors. But even if they don't have medications, some people think if they keep using any kind of eye drops, they might keep the eye healthy. Is that right or not?
No, this is not right. I mean, you don't need an eye drop if your eye is healthy. Okay, some people use some eye drops to clear their eyes, especially if you have wedding, you have some party or thing like that. They use this drops, and some they use it excessively. This is not recommended at all. Some people use contact lenses,
Yes.
and their eye gets red, and they use it to clear their eye, and this is a mistake. They should use lubricating eye drops, because the contact lenses can cause friction between the cornea and the surface of the lens itself, and that might cause scratches to the lens. This might lead also to infection, and this is like a starting a disease in the eye which was not there. So you have to use the drops according to doctor prescription.
Okay, as you have mentioned the contact lenses, I wasn't going to ask about the contact lenses, but it is very widespread used by the population we have here in Kuwait. And sometimes they use it for very, very long time, and even they sleep with the eye contact lenses. So now we need pieces of advice from you regarding the, let's say, the normal use or the best use of the contact lenses.
There's a problem with contact lenses, especially in Kuwait. It's our weather. The weather is harsh, and we have dust storms.
Yes.
So this is risk. That small particles of the dust storm might, go between the lens and the cornea, and then scratch the eye. Also, people, peer pressure, especially young girls. They don't want to wear glasses. Our recommendation is glasses number one. You have to really wear glasses. Contact lens only minimum use, especially if there is social events, things like that. You can use it, but it's not the norm. The norm is the glasses. And I always advise my patient to stop using the contact lens at least 2 days a week minimum. Never sleep wearing them. Okay, because the contact lens prevent the cornea from breathing. Because our cornea,
there's some sort of breathing into the eyes as well.
Yeah, because our cornea get oxygen from the air.
Yeah.
It's not supplied by the body, because it doesn't have any blood vessels. So there is no blood, no oxygen get to it. So it get it from the air. So you prevent it, putting contact lens in front of it. This will stop the cornea from getting oxygen, and this will cause abrasion to the cornea. So my advice is, wear it minimally. Use lubricating eye drops when you wear it. Never exchange contact lenses.
That's the point. Yeah.
Yeah. And always try to use a single use one.
The single use
daily
ones.
use.
But we still have a problem with the single use ones, because some people might buy the single use contact lenses and they use it for multiple times. Is that
some people do that, trying to save money, but it's not good. Take the weekly one then. Okay, if you're not, take the weekly one. But
otherwise the monthly one is also.
Yeah, just throw it, just take it and throw it, because you have to really use disinfectant, proper disinfectant.
Yes.
If you don't use it, then you might get infection.
Now, even like for the, I think what you have mentioned is for let's say the medical contact lenses, but sometimes people tend to wear the ones with the colors, which is used aesthetically. So they also use it for a very long time, probably for months and years. And the point is sometimes they exchange it with their sisters or with the friends. Is that right or not?
Yeah, this is not right. You never exchange contact lenses. And the other thing is actually, especially with ladies, is they use a lot of makeups.
Yes.
And they wear contact lenses.
Yes.
Especially mascara and things like that, which things like can cause dust. Okay, and this also might cause infection in the eye, hyperemia, conjunctivitis. All these things can happen.
Yeah, and in the beginning you have mentioned that the diet will play a key role in keeping the eye healthy. Is it the same with keeping yourself hydrated as well?
Yes,
especially in the summer.
This is very important point, because especially in the summer, you need to hydrate yourself. This will affect your tears production as well. If you are dry, then you don't have tears, and your eye will not be lubricated, will not be shiny.
And because we have mentioned the summer, sometimes when people goes to the beach and try to swim in the swimming pools or the beaches or in the sea, they think they have extra strength if they go down deep under the water and they open the eyes without the goggles.
Yeah.
Is that right or not?
No, I don't advise actually opening the eyes, especially in swimming pools as well, because it's contaminated. A lot of people swimming, and there is a chlor as well.
A very high chlor.
Very high chlor. So actually in the summer, we get a lot of conjunctivitis from this as well. The sea, sometimes the sea polluted, It's not advised to open your eyes, especially wearing goggles is a good protection, good advice to give people.
And I think if they open their eyes under the water, they will not be able to see anything.
Of course,
So
yeah,
it's
of course.
much more better
It's going
to
to be
wear the
blurry,
goggles.
totally blurry.
Yes, totally
never,
blurry.
never, believe the movies.
Yes, absolutely. Dr. Yousef, we are so pleased to have you today, but unfortunately we have reached to the end of our segments. Hopefully we can meet you again to discuss more about the health of the eye and ophthalmology.
Thank you.
Thank you so much. Thank you. Our dear viewers, we have reached to the end of our segment with Dr. Yousef AlThafiri. Hopefully we can meet you again with another medical specialist. Until that time, see you later.